The book, Higher Powers, Alcohol and After in Uganda's capital city, gives context to multiple persons suffering with alcohol addiction.
We take up this question as it relates to the diagnosis and treatment of alcohol use disorders in Uganda, taking a deep dive into our recently published book, Higher Powers, Alcohol and After in Uganda's capital city, to discuss therapeutic quests in Uganda that fall outside of biomedical frameworks.
Recent reports from the World Health Organization estimate that Uganda currently consumes 12.2 liters of alcohol per person annually. This, according to the book author, needed urgent interventions to reduce consumption.
Surveys deploying standardized diagnostic scales indicate an alcohol use disorder prevalence of 7.1% and alcohol dependence of 2.5%. This is approximately 3.2 million people and 1.2 million people respectively. So if you can imagine, almost the entire population of the city of Kampala over the course of the whole country.
Research participants relate to each of us in different ways, and this changes what people tell us and how we think about it. When we exchange field notes written about the observation we have made while standing side by side, we often find that we have noticed different things and come to different conclusions about them.
Stakeholders call for more sensitization and awareness about the dangers of alcohol.
We are the leading consumers of alcohol on the continent. This has implications, and one of our biggest trouble is its availability. Alcohol is everywhere, anywhere, you can take it anytime. There are different volumes, it is so cheap.
Ms. Hafsa also noted how Ministry of Health is developing guidelines for proper handling of the surging numbers of mental patients in rehabilitation centers.
There are so many rehabilitations, and each one of them is doing whatever they want. They are using whichever, models they have. Everyone does their own thing. So we are saying, no way. Let us try to regulate and have a proper way of handling our patients in Uganda. So at least we started that process and we produced our first draft.
The study was conducted within Kampala over a period of 4 years, and over 300 people were consulted. Lydia Chomkama, UBC News.